I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh, it's amazing.
Join co-hosts Jamie Rocci and Teresa Kenny as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone.
Hello and welcome to the Hormone Genius podcast. Do you have PCOS? If you do, a lot of people have PCOS. About 15 and probably more, 15% of the population does have polycystic ovarian syndrome. And we know a lot of you out there are listening and you have wondered, really, what are the strategies that you can put in place to help restore your body from PCOS, to help your body work hormonally as best as it possibly can? So today we're going to dive into how we can really help PCOS. And we have an expert guest, Ginny Noce, who is a nurse, a women's health nurse, who also got her master's degree in nutrition. So she has a lot of expertise, a lot of clinical experience to help us. So Ginny, my first question to you is, what is PCOS and why does it seem like, I don't know, why does it seem, Ginny, like there's so many different versions of PCOS? How can we understand the person with PCOS in all of its different kind of expressions?
Yeah, absolutely. And that's a really great question. And I want to first start out with I'd say the Rotterdam diagnostic criteria for PCOS, because I have seen clinically, some people think they have PCOS. Many symptoms overlap with a lot of other conditions like hypothyroidism. So it's really important that first and foremost, we're getting an accurate diagnosis to say, I actually have PCOS. And then that helps us to be like, what are we actually going to do about that? So, the criteria to get diagnosed with PCOS, polycystic ovarian syndrome, is number one, have irregular ovulation or irregular menstruation. So you're maybe going like 40 days, maybe 60 days between periods, or you're not ovulating at all. So you have an absent menstruation. Then the second criteria is hyperandrogenism. And from my understanding too, sometimes in different diagnostic criterias, it's either you can have the clinical symptoms of hyperandrogenism. So these are elevated androgens. So either that be hirsutism, which is excess hair growth. Basically, I always tell my clients it's hair growth where you don't want it, your chin, your chest, right? And then we lose hair where we don't want to lose hair. It's like on our head. You can have acne. And so we see that either clinically with the actual elevated androgens, testosterone or DHEAS. So I really prefer to see those elevated androgens as well. And we can go into too as well. I've seen like the normal ranges, I say that in quotations, be like upwards of like, you could have your testosterone in the 50s and it's totally okay. Where that's not okay, in the restorative reproductive medicine or the functional medicine world, we ideally like to see it under 45. So, going into a little bit of the weeds of that can be a little tough too for, a client. And then lastly is having actual polycystic ovaries. And so that's when we call like that string of pearls. You're seeing all those stimulated follicles on the ovary, and we're really having a hard time recruiting that singular follicle. So this is different than just having a cyst on your ovary. You have to have that, right? The polycystic, those several cysts going on, and that is identified via an ultrasound. So with that criteria, you have to meet two of the three to be diagnosed with polycystic ovarian syndrome. And, part of, my love, I guess you would say, for PCOS was my own, struggle with it. And I actually marched into my doctor's office and I was like, I want you to test me for PCOS. No one had brought it up to me. And I was like, I want you to test my androgens and I want an ultrasound. And if you know me or learn to know me, that's like, that's very classic Ginny, to just kind of march in there and tell her doctor what she wants. And then lo and behold, I had, all the clinical criteria. So, that is kind of the basis of what we're going off for, to be actually diagnosed with PCOS. So, my big thing is kind of getting to, well, why are our androgens elevated? Why are we not able to recruit a follicle? So yeah, does that help answer your question?
Yeah, I was gonna ask Ginny, but you just answered it. What about your case did you know, oh, I think I might have PCOS. And you just said it's because you expressed these, signs of PCOS that you knew that you personally knew about. And something that Teresa and I talk about a lot is, typically there's like a stereotype look of the PCOS woman. I feel like that maybe get doctors in trouble. If a woman's coming to a doctor and her cycles are strange or weird, or she's trying to achieve pregnancy and she doesn't fit that stereotypical look of PCOS, which typically does include like, the thinning hair, the acne, but being very overweight, and so I'm sure I can imagine, Ginny, that many doctors probably just kind of, yeah, they stereotype their way out of a good diagnosis for that woman, which is unfortunate. So, Ginny, when you shared this demand with your doctor, how did they respond to you? And then what was their reaction when they actually learned that, in fact, you do have PCOS?
Yeah. So also a little bit more context too. I'm a relatively thin, I typically have a BMI around 20, 21. So, I'm relatively thin and I was having a ton of cystic acne. My cycles were 60 plus days long. And so those were, really the big indicators to me. Hey, something's off. Where's my cycle? What the heck is going on with my skin? But I didn't have any weight gain. And, really with that diagnostic criteria, being overweight is not part of the diagnostic criteria for having polycystic ovarian syndrome. Now, weight gain can be associated with PCOS because of the underlying drivers, but it is not part of that clinical diagnostic criteria. And I think that's so important because one of my best friends, she's actually a MD. And so when she was going through residency, she was saying how she was going through like the OBGYN and her instructor was like, she was like, we should really screen one of their patients for PCOS. He was like, she's not overweight. She can't have PCOS. And that is extremely concerning to me, as that's your doctor saying that, nope, she cannot have PCOS because she is not overweight. And it's, just to me, I'm like, do you not understand the diagnostic criteria? Like, we need to kind of walk you 10 steps back here. So so I was doing my own research. I was reading actually Dr. Jolene Brighton's Beyond the Pill book, and that kind of gave me like those clinical clues that it was PCOS. And luckily, I was working with a really nice doctor. I will say she was so kind, and she was like, "Yeah, okay, yeah, we'll run these tests." Like, she kind of looked at me like I had 10 heads a little bit, like, "Why do you want this run?" But okay, sure. And again, sure enough, I had it. And her advice to me was go back on birth control pill. So I had previously been on that. So go back on birth control or try a ketogenic diet. And I was like, both of these are just not really good options. And so, where I was in college at the time. So I didn't have my master's degree yet in nutrition and functional medicine. And I was not well equipped at that time to be like, what is going on? I just left the doctor's office and was like, great, no one can help me. That's how I felt. I was just like, so here I am. I have no options. I have horrible cystic acne. Like, where are my cycles? What do I do? So I was just really left with very little options. And I think that is what we're seeing a lot with our, women with PCOS is basic. And what I hear from women, and you guys can, tell me what you hear, but I hear, hey, if you're not trying to get pregnant right now, if you have PCOS, then go on the pill, right? That's what the advice is.
So, from the standpoint of what your doctor was trying to accomplish, like I want people to understand this. She offered two things. One addressed keto, right? Like from a nutrition standpoint, she was like, oh, you have PCOS, so therefore you have insulin resistance. Therefore, to bring your insulin down, this is the answer, ketogenic diet. Okay. Secondly, the birth control pill, which that doesn't address insulin resistance at all. In fact, it makes it worse, we know. But from that standpoint, what they're trying to do is say, you need a protection in a sense from uterine cancer. I mean, that's essentially why they put it. It seems so crazy to me because honestly, uterine cancer it takes years and years to develop. It's not like it's something that happens overnight, but it's the one thing that they say you have to be on the pill because you got to prevent uterine cancer, but you don't. And that's the other thing. You actually don't need the birth control pill for that. So they're trying to address those two things. Ginny, what I want to know from your perspective is how many people like you who are lean, who have PCOS, actually are insulin resistant? And also in general, I mean, like, I guess how many PCOS patients have insulin resistance? Because you obviously didn't ask for an insulin resistance test, didn't you, right? That's not a part of the criteria per se. Just like you said, just being overweight isn't part of the criteria. However, if we look at what we call the underlying root kind of pathology of PCOS, people would say it's insulin resistance. So help us to understand the insulin resistance piece and really who does this apply to? And does every patient with PCOS have to deal with insulin resistance or not?
Yeah, this is a great question. So I will give you a little bit more of my story. So, a few years after I was working for FEM as their clinical care manager, which is another restorative reproductive, endocrinology organization, and I did their full basic hormone panel, which included a 2-hour oral glucose tolerance test. That is, you take this delicious 70 grams of glucose, and then they're going to test your glucose and insulin every 30 minutes over 2 hours. And I was actually not insulin resistant. And so based on the research, so this has really made me dive deep into the research on what is this percentage of women with PCOS or with lean PCOS that have insulin resistance. Now, unfortunately, in the research, there is not a ton of differentiation between lean PCOS and obese. Based on what I've seen, up to 70% of women with lean PCOS do have insulin resistance. So answering your question is, anyone with PCOS, blood sugar, we do need to focus on insulin resistance. And then especially upwards, for those who are overweight and obese, I mean, it is upwards to 85% of those people do have insulin resistance. So I do think that and getting your blood sugar, under control, not only are you going to feel great if you do that, but, I think it's a general principle I'm having any woman with any hormone concern deal with. So, I think that, yes, most women do need to be addressing that anyways. But with that, 70% of women with lean PCOS that have insulin resistance, it begs the question, well, with those other 30%, what's going on with them? What are those additional underlying drivers? If it's not insulin resistance, what is it? And I'll also back up to say, if you're wondering if you have insulin resistance, you don't, in my opinion, need to start off with that oral glucose tolerance test first. You could grab a fasting insulin, a fasting glucose, which is when you go to the lab after 12 hours of not eating. Ideally, please do that from an overnight fast. Don't do 12 hours during the day of not eating. And then you can test your insulin, your glucose. You can also grab an A1C. So those are some, lab markers that I'm looking at with my clients to look for any signs of glucose dysregulation.
I have a follow-up question because I do wonder about this, Ginny, and I've been in practice with PCOS, and I used to run the 2-hour insulin glucose tolerance test more, but I've got backed away from it and I'm doing more fasting insulin because obviously no one wants to drink that drink. Yeah. It's ultra processed and it's just not good, but it does give information. So I've gotten more into fasting insulins, but I do wonder if that is going to catch always insulin resistance. And what I mean by that is, like, a lot of people do have good fasting insulin, but their response to a carbohydrate load is not the same as a fasting insulin. And I guess, do you feel like you can tease that out a little bit, or do you feel like a fasting insulin kind of always would show for sure if someone has insulin resistance? And maybe we don't know. Maybe there's just not enough data there.
So I do think the range really matters that you use. So I'm actually using a pretty aggressive range of under 8 for fasting insulin. Some will even argue in the functional medicine space to use under 6 for fasting insulin. And when you back up the range to that, you're going to catch a lot more people. So now I'll also marry that with a fasting glucose. I like to see under 88. And then I will also do the A1C, and I like to see it under 5.4. So when I use those ranges, I will catch a lot of people. And then this is where my clinical expertise does come in of, I could look at someone's, fasting insulin and, look at, maybe they look okay. And then I look at the way they're structuring their diet and I hear, their movement. I know they're not doing any resistance training. So I look at all of those other factors, and I can say there's probably some sort of level of glucose dysregulation going on. Another marker to look at is those triglycerides. Being over 90, it's a really big indicator that you're having some excess insulin production. So when we look at if we use the right ranges, we look at several lab markers, and then we use that in conjunction with their diet, their lifestyle, and then maybe some symptoms of, are you having crashes in the afternoon at 2 to 4 p.m.? Are you waking up in the middle of the night? Are you dealing with chronic fatigue in general? We can tease out and find some evidence of some glucose dysregulation or insulin resistance. And then I will say, just at the end of the day, if someone, labs look really great, but I'm always going to focus on glucose regulation with all my clients because it is foundational. So we're kind of doing that anyways. But it is always nice. I always like the lab testing for being able to show someone that change. So, at the end of our program, we'll do retesting, and it's good for them to see oh, I actually improved it. Even though I'm feeling a lot better, it's good to see the lab markers improve.
Awesome. Well, I'm going to interrupt our podcast here and just give a shout out to our podcast partner, We Heart Nutrition. We love We Heart Nutrition supplements. If you're looking for an amazing brand that stands for an amazing mission, please check out weheartnutrition.com. They focus on women's health, but they do have some men's health supplements as well. If you visit weheartnutrition.com, you will get 20% off of the supplements and use Genius as the code GENIUS. We love, 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 love We Heart Nutrition. Thank you so much again for sponsoring us. Okay, so Ginny, we've been talking a lot about glucose and insulin resistance and how this is so important when we think about PCOS. But tying it back to your case, you were saying that you are not in that percentage of women who struggle. So when we think about the root cause of PCOS and knowing it's not just a one size fits all approach, how would you explain what you've discovered about the root cause of your PCOS? And then what did you do to help kind of remedy some of these symptoms and also address the root?
Yeah, absolutely. So other underlying causes, and I always say there is research to support this. I've written several research papers on PCOS and seeing these underlying causes. So one being underlying gut dysbiosis or inflammation or dysregulation in the gut microbiome. We also see chronic low-grade inflammation and oxidative stress be associated with PCOS. And I would say those are two biggies. Some other things we've seen in the research is environmental toxins be actually associated with PCOS and potentially poor detoxification pathways. And these can all also influence insulin resistance. So that's really fun. I have this really cool on one of my posts on Instagram. It's like, here's PCOS, and then here are all these different root causes. And basically there's an arrow of how this root cause can actually lead to this other root cause, how that can lead to PCOS. So it is complex. I always say it's not A plus A. 1 + 1 = 2. It's kind of like 1 + 2 divided by 3. It's very complex, right? That PCOS puzzle. So those are some of the really big ones that I'm seeing in practice. Again, recapping, being the gut dysbiosis, chronic low-grade inflammation, oxidative stress, and then potentially that kind of detox pathways or, environmental toxins. Now, in my personal story, what is not surprising, I guess not surprising to me now, is I also struggled with IBS since I was probably 14. And it was, chronic bloating, chronic constipation. And so that was a really big part of my story, was also trying to figure out what the heck was going on. I was to the ER for constipation. And, I was also relatively thin. So I was met with, you don't actually look that bloated. Well, I feel very bloated, so thank you for that, help. I was given Miralax, Cheerios, and I was like, what the heck? So that kind of led me down the rabbit hole of gut health. And, this all really fueled of why I went to go get my master's degree in nutrition, as I had gone to all the GI doctors, for my, gut issues. I went to the conventional medicine, for my PCOS. And then I went to the dermatologist for my skin. And that made it 10 times worse. I tried a topical tretinoin, and that was the worst decision of mine probably entire life. I don't have much regrets in my life, but topical tretinoin is definitely one. It made my sin. They're just like, don't worry, you'll just purge. And I just purged for months and months and months, and it never have helped me. Anyways, so, so it was kind of all these experiences culminating into, going to get my master's degree in nutrition and functional medicine. And so, then that's when I dove deep into gut health, found out I had a candida infection in my gut, and did a lot of healing with my gut. And that's when I saw such amazing improvements in my skin, in my gut health, obviously, like my digestion. And then ultimately, my periods started to be more regular and all that fun stuff.
So I hear what you're saying is like the acne part. And I see a lot of women, PCOS, obviously acne is a big thing, but in general, just hormone dysfunction. But it seems like this gut connection to the acne is kind of the root. Um, do you feel like for people that have gut issues, in relationship to PCOS and have really bad acne, like what are the steps they could maybe take on their own? You mentioned the dermatology route doesn't always work, and we see that all the time. Like they've tried every topical under the sun, and it seems like they need to be cleansed from the inside out. But I've also seen people try that on their own, and like clean their diet up and do all the right things, but their acne isn't getting better. And they're confused. I'm confused. It just seems like acne can be very stubborn and frustrating. So give us your help in that area.
Yeah, so with acne, I will say my root causes to acne definitely gut dysbiosis, but also um, really not absorbing our nutrients and nutrient deficiencies in general. So we also have research with those with acne have lower levels antioxidant capacity. So lower levels of vitamin A, vitamin C, vitamin E. And this could become from like the nutrient standpoint, maybe we're just not eating foods rich in vitamin C, E, and A. And coincidentally, those vitamins are also so important for healing our gut. So it's nice that if you start including foods with vitamin A, which would be, your orangey type fruits and veggies, and then also more bioavailable vitamin A, which is found in egg yolks, and also beef liver, the uncommon one that people will be eating. And then vitamin E is avocados, almonds, sunflower seeds. So again, just whole foods that a lot of people aren't eating. Vitamin E is probably one of the highest nutrient deficiencies of those in the USA. Just a little fun fact. And then vitamin C is going to be just, I think, like fruits and veggies in general, but especially like berries, broccoli. Those are some big ones. So those are kind of some steps. Okay, get your vitamin rich foods because you're going to tackle a lot of things. And that will even, I'll say that those vitamins are huge in also repairing oxidative stress I mentioned and that chronic inflammation for PCOS. So I always say that's so like why I'm obsessed with food is because it will tackle so many areas at once.
Okay, so Ginny, I have two questions. I'm battling them out in my mind right now. I'm going to ask one and then I'm going to have a follow-up question, okay? So first one is this. Obviously, food can be medicine 100%. If we're eating the right food, food can be medicine. And also food can be very detrimental to our health, like the quote unquote dead food, completely ultra processed foods that aren't even food in the first place. Okay, but because of our agricultural systems, GMOs, all this, our depleted soil, and all these foods, like the apples we're eating today, are like 1/50th of the nutritional profile than they were 50 years ago. How do you reconcile this? Like, maybe 50 years ago, no one needed a supplement. They lived off the land. Okay, maybe 100 years ago, whatever. But, people were living off the land. They were hunting and gathering, and again, even further than 100 years. You know what I'm saying?
Mhm.
So how do you reconcile that? I mean, we want to eat healthy, obviously, but even just eating healthy alone, sometimes I can imagine doesn't even meet the full standard that we need for vitamins and minerals. So how do you go about recommending supplements to the people you work with?
Yeah. So number one, I will challenge that a little bit because very little do I see actually someone eating up to 6 servings of fruits and veggies a day. Like, find me someone who is eating actually their 6 servings of fruits and vegetables a day. Not a lot of people. So, and I 100% agree. Like, our soil quality sucks, and I even that with myself. I mean, I'm very, anyone who knows me, I'm very, very healthy and I take a lot of supplements. I'll just be totally honest. And I found that that really gets me to like my optimal level. But I think some people focus on the pebbles before moving the big rocks, right? They're not consuming, I recommend to my clients, and I get very specific based on their labs and based on their clinical picture, what exact fruits and veggies to be focusing on. Is someone increasing their veggies, but it's just like zucchini, like that's not a ton of nutrients versus are you doing a lot of like dark leafy greens, cruciferous veggies, right? So, and then, is your fruit a banana? That like it has some potassium, but like that's not moving the needle on vitamin C. Are you doing your berries? Are you doing your citrus fruits, right? So I think that, first and foremost, I'm helping people get actually very specific with their diet because 95% of the clients who come to see us are already eating healthy. I wish I had someone coming to eat McDonald's. Oh my gosh, like I would die. I would be like, oh, you are so easy. This is like amazing. 95% of our clients are eating well, but they are still not eating optimally. So they have now removed the, junk food. Great, that's a great first step, but they have still not actually included the foods they need to. And so that is one of my big beefs right now in like the nutrition space is that we focus so much on what to remove and not enough on what to add in. And with just the vitamin supplement section is my goal as a clinician practitioner is to really prioritize based on their clinical picture, their lab work, what is most important supplement wise for them to take. So for example, someone may have like an atrocious gut versus another person just may seem like super nutrient deficient. That's a completely different, supplement picture. Or we'll work in phases. Step one, focus on the gut. Let's get that in tip-top shape. Then let's go like focus on your like vitamins and minerals because I really try not to have people taking like 10 plus supplements. We try to keep things minimal. So a lot of times we are working in phases with our clients as well.
Awesome. Okay. And then that's this was so helpful. Thank you for setting us straight because that is a great point. Like it's easy to say, oh, the soil sucks, but then just still reflecting back on what's on your plate though still. And also being very specific to what each individual needs is so important. Okay, the second part of my question was when you were trying to again figure out the root cause for you, you said it was gut health, right? How did you go about knowing that? Did you order like a gut test through the mail? Did you talk to your doctor about it? Like what were the steps you went through to understand the health of your gut?
So this is where my love for the GI map came from, and we do run a GI map with all of our clients now. But I ran the GI map through Diagnostic Solutions, and that is a really, I'm obsessed with it. A really great picture of the gut. You're going to see your good bacteria, quote unquote, your quote unquote bad bacteria, how well you're digesting. So I'm going to get in the weeds a little bit because it's when there is any gut infection, we need to ask the question, why was this infection able to overgrow? Unless you like visited, like I had someone visit Uganda and they got like a parasite, like, okay, like that's not, not the case. But in most of our clients, like with Candida or H. pylori is another very common infection that's in 40 to 50% of the USA population, is that there was an environment in the gut that allowed this bacteria or fungus to overgrow. And so for me, my history was chronic undereating, chronic dieting, over-exercising, on top of a childhood of a standard American diet. I was eating Big Macs, McDonald's twice a week. So definitely this allowed for an environment of overgrowth bacteria, a low immune system in the gut. So then when I was chronically under exercising, under eating, this just allowed for an environment for an infection to overgrow. And so first step is to get rid of that infection. Yes, it is important. You'll see a lot of symptom improvements from that. But ultimately, then my goal was to support my gut lining, increase my immune system in my gut because I don't want this to happen again. And if you guys have heard like SIBO, small intestine bacteria overgrowth, you have people who are like, they're treating SIBO every 6 months. They like can never get rid of it. And that's because the SIBO is not the issue. It's the underlying environment of the gut. And the other really big thing in the gut is that I'm also obsessed with is our digestive secretions. So your stomach acid, your bile flow, your pancreatic enzymes, not only do they help you digest your food and absorb your nutrients. So if you are lacking in digestive secretions, that can also contribute to those nutrient deficiencies. So right when you're like, oh, we're not like, eating enough, like our food doesn't have enough vitamins, minerals. Well, I'm like, okay, well, if we're at least going to be eating those foods, like we better be digesting it to the highest quality to like get all we can out of that. And then the other big thing I always say, your gut has checks and balances. It's not meant to be perfect. And those digestive secretions are also antimicrobial. So if you have poor digestive secretions, not only you're not going to absorb your food well, nutrient deficiencies, but also that allows the environment for overgrowth.
So do most people that you're working with, because I know digestive secretions obviously come from a good functioning organ system from the gut, but like do you think that people when their gut is unhealthy kind of have to supplement that with digestive enzymes? Like is that really helpful? People ask about digestive enzymes. I think everybody hears about probiotics and but people don't talk about digestive enzymes. Where is the place for digestive enzymes in clients that you work with? And maybe it's not as much as I think, but I think if you're saying that digestive secretion is so foundational to like absorbing nutrients, maybe a lot of people aren't, they don't make enough.
Yeah, absolutely. So first and foremost, it's the degree and what digestive secretion is lacking. So in the GI map, we have two markers, elastase, and then we also have steatocrit. And steatocrit would be like if there's fat in your stool. So that would be like, hey, you're not breaking down fat, and that's a bile issue. So I'm going to hone in on bile flow, or if someone has a very low elastase, this could be more of a marker of low pancreatic enzymes. And so that's when more digestive enzymes are going to come into play. But if you do digestive enzymes when someone has a bile flow issue, that's not going to help them, right? So some big signs of like poor bile flow is, and I have actually a new gut guide that is like breaking down like your gut symptoms and what the potential root causes are. I worked like really hard, and then also the patterns. So like patterns that you would see if like you have like poor bile and things like that. So we can definitely link to that because that is goes into like all of these like details. But that's a really big, place is determined like where is the digestive secretion issue. And then stomach acid, that's going to be like your hydrochloric acid. And so you can actually supplement with that. So you would, if it's a stomach acid issue, like protein sits really heavy, maybe you have H. pylori, then you're going to want I can't say it right, but you're going to want that and not digestive enzymes. So there's actually a very fine tuning there that can make a really big difference in clinical symptoms. Now, some very like general things people can do to support their digestion: chew your food till applesauce consistency, eat without distractions, eat whole foods. Yes, those are going to help your body naturally produce your digestive secretions. And what do we see everyone doing? They're not chewing their food. They're also eating with their phone. They're in the car with their kids, right? No one's taking the time to actually there's an amazing study done. We're like Pavlov's dogs. It was like when you're cooking dinner, your brain will sense like dinner is coming from the smells and all those things, and your body will start producing 20% of your digestive secretions. And so I always think about that with the convenience food. If we take out the cooking, we take out that time, the prep, that's also probably really reducing the body's ability for those digestive secretions. So super interesting stuff. But, back to your question, I'll answer real quick. People can trial a digestive enzyme, but our goal is to also wean them off of it eventually. Nutrients like zinc, sodium are important for building up your digestive secretions, like cruciferous veggies. Fiber is really helpful for bile flow. So we're going to work on the back end systems to support natural production and then ultimately wean you off of any digestive support, ideally.
I have a follow-up question. You obviously we're talking people are really obviously interested in supplements, and you acknowledge you take supplements, I take supplements. So from polycystic ovarian syndrome standpoint, what do you think the most foundational supplements could be, or where people can really get better? Because we know like with PCOS, again, we're working on insulin resistance, there are some supplements that help that. What are your go-tos for PCOS?
So my go-tos are a little different than maybe what you've heard. So I love vitamin E. Actually, we do have research with vitamin E because it's going to calm inflammation, oxidative stress, support the gut lining, and also play a role in fatty liver.
Okay, stop right there with the vitamin E, because I just want to know, because there's two different, well, there's types of vitamin E. Sorry, I just wanted to ask this before when you brought up vitamin E, what type of vitamin E? Because like, it's kind of like, old kind versus the new kind. I see the gamma E versus like your just traditional tocopherol kind of vitamin E. So what vitamin E?
So I like to do a mixed tocopherols, and I like the brand AC Grace, and they have a mixed tocopherol. I'm using that one pretty much exclusively. And then I'll get aggressive. Like I'll go up to like 800, 1200 IUs, because we just see inflammation as such. I mean, that's like, I will say that is a pretty big common pattern with all my PCOS women is inflammation. So I'm kind of thinking like, what can calm inflammation? So I'm thinking vitamin E, do the mixed tocopherols. I do love N-acetylcysteine, probably one of my hands down favorites. And we do also have research that women with PCOS, bear with me, have a higher marker of this marker called GGT. It's $3 to run. It is so easy. I don't know why it's not run more, but it can indicate the need for more glutathione, and NAC is that precursor to glutathione. So I do think it's really, really helpful. And then I will say targeting the gut, I do agree, but that is unfortunately going to be a little bit tailored to what the person's gut issue is. Do we need to focus on supporting the gut lining with more of like L-glutamines and carnosine, or do we need to focus on addressing an overgrowth with some like general antimicrobial herbs? Like oil of oregano is great. And I don't know if you heard the brand, oh my gosh, Biotanical. Oh my gosh, they're Biocedin. I'm like, what is their, I think botanical research. So generally a probiotic has been shown, to be studied. I like the spore-based from Megaspore by Microbiome Labs. So those are kind of going to be my go-to. Inositol, I don't use a ton. I do use it here and there, but I really find this is one of my favorite hacks for blood sugar is doing a protein and fiber shot before meals and then making sure to get in movement before or after meals. And I find that works so much better than blood sugar for blood sugar. Inositol, I'm honestly thinking more so for like egg quality, which is fine. I'll use it here and there, but I actually, from a blood sugar perspective, I think fiber has some of the most research when it comes to supporting glucose.
What about apple cider vinegar?
I actually like apple cider vinegar. It actually can help also support digestive secretion. So I've had people trial like, 1 to 2 tablespoons and 4 ounces of water prior to meals for more of a digestive support. But yes, we do have that research that it helps to reduce that glucose spike. Honestly, my biggest issue is people will not do it.
It's like nasty.
I think it would be really cool. It just tastes horrible. So
So
a
bad.
really big thing I'm focused on in practice is applicability, like people's ability to do something. Because if we give protocols that are too hard, like sauna, very cool. I love sauna, but I don't tell people to go get a sauna. It's not realistic. Right. So, really part of our practice is kind of putting that realistic spin on things, because we've had so many people going to functional medicine providers and they're just giving like, here's like, the most like expensive, and like you're gonna have to drop everything in your life to be able to do this protocol. And, not saying that that's necessarily like, does that mean it's a bad protocol? No, it could work, but our big thing is like, I want this to work forever. I want this to be something you can do forever. So that's a really big part of our practice, is making sure our recommendations are realistic for the long term.
Right. Right. Because it's psychological for sure. And especially when you bring in the food and women. I'm reading this book right now and it is so good. I'm probably in chapter 3. It's called Battling of the Sexes. And it's about how junk food, so they talk about junk sex for men and junk food for women, and how the part of the brain is activated in the same way when we're binging on food, as same as if men are overindulging with whatever.
Mhm.
So I think there's so much emotion tied, and there's so much driving our desire for food, especially on where we're at in our cycle. So Ginny, I just want to say you are awesome. You were so good. This interview has been great. So good. You are so smart. Here's the deal, people. We live in an information age. It's an information age. Information is super cheap. You can find it anywhere, and you can find whatever you want. Whatever you're looking for, you're going to find it. Like as in, I want to prove my point that whatever thing is good, I'm going to find somewhere that says that this idea I have is a great idea, even though it could be total bunk. But Ginny, for you, you've done your research. You've done your research. You went to school as a nurse. You're a nurse. You went and got your master's degree, and you're pursuing these areas of expertise that really does increase the trust in you. Because I just think back to a conversation I had last week, and this was spurred on by what you said about, people giving advice. And a friend of mine saw 3 functional medicine doctors within the course of like 2 weeks. And they were giving her terrible advice. I mean, so
Bad. It's so bad.
bad, bad. My friend is in total adrenal fatigue. She is so stressed, but she was told to fast. She needs to heal her gut. She needs to fast. Well, no, she is in so much stress. The things that these doctors are sharing, I don't even know. So that's the danger in information age.
Mhm.
Anybody can share anything for any reason whatsoever. So basically, this is my whole long soapbox to say, Ginny, thank you. Thank you for doing your research. Thank you for kind of explaining this whole kind of sphere of health to us because it's something that is important and a lot of people need to pay more attention to. Okay, so as we wrap up here, unless Teresa, do you have any questions before? Okay. Um, so Ginny, again, awesome work. What do you wish every woman knew, Ginny, about their hormone genius?
I wish that every woman knew that her hormones are not broken. They're just trying to speak to them. Right? They're not something that we need to suppress. They're not something we need to control, but rather they're signaling to us something deeper going on. And so part of our genius is trying to learn and listen to our hormones and connecting that to that our hormones are generally responding to the environment we're surrounded with, that whether that be our food, our sleep, the people we're interacting with, us interacting with the environment, going outside, all of those things are going to be influencing our body and their chemical signals. So, if we can start leaning into our own intuition more, instead of just trying to control things, either that be, with a pill or whatever, we'll see a lot more improvement in our hormones and our health.
Awesome. There was a question I had, and you could throw this into this last answer because I feel like it's just gonna be fast. But what is a protein fiber shot? Like what is that and what's your most like common protein fiber shot? I was just wondering about that thing. And then tell us, Ginny, then where people can find you, where people can work with you. We will link whatever that super cool gut underlying root kind of thing. We'll link that in the show notes, obviously, but give us all your details.
Okay, so the protein fiber shot is I'm generally getting in the research they use whey protein and it's getting about like 5 to 10 grams of protein and then about 5 grams of fiber. You got to be careful with this. Go low and slow. You don't want to just do 5 grams of fiber 3 times a day. You'll maybe poop your pants. So just go really slow and slow with the fiber part of things. I love Sun Fiber, which you can find on Amazon, or Fiber Mend by Thorne. And so what I have my clients do is like get I'm trying to think of brands. I know like a Quip protein, whole, oh my gosh, like whole something, protein, whatever. I'll have them just get like a protein shake, whatever. And I have them at the beginning of the day do like the protein shake in like some milk, add the fiber in there, and then section that out to 3 servings a day. So just doing like, 1/3 of that prior to meals. So that is very easy. Boost protein, intake, great for our muscles and all that good stuff. We didn't even talk about like lean muscle mass, right? That's a whole other podcast. So yeah, so those are the protein fiber shots. Love those. They're also great for weight loss. I know a lot of people are looking for that, just saying, because they increase satiety, they increase GLP-1. Everyone's obsessed with GLP-1. So do that, chew your food, and you'll be feeling really pretty good. And then where they can find me is I am on Instagram at The Women's Health RN, and my website is also The Women's Health RN. People forget but it's there. And I have now 4 free guides we can link. I have a deep dive into mastering your hormones, and I go deep on cycle charting, what your cycle biomarkers are indicating, about your hormones, where to start with nutrition, and also all the functional lab ranges I run and the optimal ranges. So that is a huge guide that I also did like a free training with as well. So like a video of it. I have 11 red flags if you're trying to conceive. So what to be looking for and what those red flags could be potentially indicating about your fertility, where to start with nutrition. I have a Nourished Mama starter guide. So for any like pregnant, breastfeeding, or postpartum moms, where to get started with nutrition. And then lastly, the gut guide. So, so how we work with our clients is in a 4-month one-on-one program. We specialize in PCOS, gut health, fertility, PMS, pretty much all of your women's health concerns, like we're your go-to girls. So we're mainly working with clients inside our 4-month one-on-one program right now. But before you get started with that, you can always start with my free guides. So that is where to find me. I share lots and lots and lots on Instagram. I would say before you work with us, just seriously take a deep dive dive on my Instagram first and then decide if you need me, because I don't want you to not need me if you don't need it.
And what was your handle again and your website?
The Women's Health RN, and women's with E.
Got it.
So good. Thank you, Ginny. Like, you have so much information. Thank you so much for giving this free to people. Really, it's beautiful. But reach out to Ginny if you are struggling. Obviously, she has a lot of information, and I'm sure it can really help many, many women across the country. Thank you, Ginny. We'll have you back again, because I think we definitely need to do whatever you want to. Lean muscle mass. We will do a deep dive on more stuff with you in the future. So thanks so much for being here.
First, thank you, ladies, for having me.
Thanks for listening to the Hormone Genius podcast. Please remember to share our podcast with your friends and family, and also follow us on social media. If you were not aware, we have a YouTube channel. So if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside you as you discover the beauty and the genius of your hormones.